Welcome, everyone. Yes. Hello, welcome to everyone coming in. We are going to take a couple of minutes to allow people just to arrive to the room. Then we will start in a couple of minutes once we've been able to admit everyone from the waiting room.
Колеги, не дивуйтесь, що ви бачите на цій зустрічі дуже багато Ірин Франков. Це так трапилось, тому що ми поділилися прямим посиланням в останню хвилину, щоб бути впевненими, що всі отримали доступ. Тому, колеги, будь ласка, ви можете себе переіменувати по ходу нашої зустрічі.
For everyone, if you can look in the chat, there's information there about how to set the interpretation. We have interpretation available between Ukrainian and English. You will find it by clicking on the globe icon, or sometimes you might have to go to more and then choose from there the interpretation services. So if you speak English, you choose the English channel, and for Ukrainian, you choose Ukrainian. We will start in about 1 minute. Welcome, everyone. We already started the recording, and I think we will officially start now. More people might be dropping in still, but that's okay. Thank you so much for joining us on this webinar today as ARC International, in partnership with Vrije Universiteit Amsterdam, launches the interdisciplinary desk review on mental health and psychosocial support in Ukraine, coping, help-seeking, and health system strengthening in times of war. My name is Sarah Martinmäki. I am an MHPSS researcher and policy advisor at ARC International, and I will be facilitating today's webinar. Last month marked 2 years since the start of the Russian full-scale invasion in Ukraine, and as the war is continuing to have devastating impacts on the mental health and psychosocial well-being of Ukrainian communities, this report was created in the past 1.5 years. The report provides an overview of the historical, cultural, health, and humanitarian factors that are essential for understanding the traumatic impact of war on the Ukrainian population and for developing responses that also incorporate localized idioms of distress, help-seeking behaviors, and sources of resilience. And the report is intended really to serve as a critical tool for any organization that is aiming to develop mental health and psychosocial support programming that is appropriate and responsive to the particular psychosocial needs of the Ukrainian population. It also highlights the importance of building on the policies and infrastructure that existed before the war, and how historical conflicts and traumatic events have shaped present day's needs of the Ukrainian population. We also touch on the importance of multidisciplinary approaches for understanding the impact of war on this population and how to develop responses that incorporate various sources of resilience. Now, before we start with the panelist presentations, I'd like to give you just a little overview and also present some house rules that are also in the chat. Many of you have already seen. So we will first start with presentations from our 3 panelists that I will introduce shortly. And after that, at about 4:45 Central European Time, we will switch to a Q&A session, and we hope to really engage you in a lively discussion about. And we will conclude the webinar by 5:30 Central European Time. And as I mentioned before, we are recording this event. If you would like to ask any questions or make comments, please write them in the chat. Or after the presentations, you can also put your hand up to ask a question. And because we have 3 presentations, I'd like to make sure that we have enough time for questions to all our panelists. We'd like to ask you to save your questions until after the presentations, but please do write any of them down in the meantime, so that we can come back to them later. Our chat moderator, Katerina, will note them down, so we will make sure to remember. One more final note about the language. Some of the presenters will present in Ukrainian and some in English, so please make sure you have chosen that right channel so that you can follow. You can ask your questions in the chat or after presentations in either English or Ukrainian, both are okay. And the desk review itself is in English, as one of the main aims is to promote information about the Ukrainian context to international organizations working with MHPSS in Ukraine or with Ukrainian communities elsewhere. So, without further ado, I would like to introduce today's panelists. We have Irina Frankova, who is a postdoctoral researcher, the Department of Clinical, Neuro and Developmental Psychology at Vrije Universiteit in Amsterdam. She's also a senior researcher at ArcCentrum 45 here in the Netherlands, assistant at the Department of Medical Psychology, Psychosomatic Medicine and Psychotherapy, Bogomolets National Medical University in Kiev, Ukraine. We also have Orest Suvalo, the CEO of the Institute of Mental Health at Ukrainian Catholic University, coordinator of community-based mental health services development at the Mental Health for Ukraine project, co-chair of Lviv Region Local Mental Health and Psychosocial Support Group in Ukraine. And our last panelist is Hanna Goloktionova, Mental Health and Psychosocial Support Advisor at IFRC Reference Center for Psychosocial Support in Denmark. Welcome, and thank you so much. Irina, I give the floor to you.
Sarah, thank you so much for this kind introduction and pronunciating our surnames correctly. It is always nice to hear that. I want to welcome everybody today who is present online, both our international colleagues and colleagues in Ukraine. I'm very happy to see many familiar faces, and I really hope that this webinar will create, or online launch will create, an opportunity for communication and exchange. I will now switch to Ukrainian. You will see my slides in English. My presentation will be in Ukrainian, but I'm happy to answer your question in whenever language you will ask me. Доброго дня, шановні колеги. Я вітаю вас. І для нас всіх це важлива подія. І я хотіла би сьогодні...
And I would like today shortly and briefly to present my overview of our review and to share with you some important investigations that we have found in our report. So they will be depicted in this report and shown in this report. So my part will be dedicated to presentation that is connected with coping, help seeing in Ukraine during the times of war, and how it affects psychic health and psychosocial support in Ukraine. So, at the beginning of war, full-scale invasion, a lot of international partners, organizations, humanitarian organizations, they got a challenge to support Ukraine in giving psychological help and psychosocial support. And at the same time, they came across some gaps in understanding which services already exist, and it motivated us to start working more and to have a literature overview. And also, we include interviews of key elements for writing. But of course, the center of giving services is a woman and is a person, excuse me, and it is impossible somehow to program or to launch some projects without understanding local contexts, without understanding history, social, economic factors that affect the identity of a Ukrainian. How Ukrainian can seek for help, how the Ukrainian sees him or herself in the world. So in this report today, there are 4 parts that include the descriptions of these factors and also the description of formal and informal services of providing support. And by the end, we'll make up a certain analysis of those gaps that are, and we will give several recommendations for our international partners concerning the fact where should they affiliate, where should they go. It is important to say that recommendations are subdivided into several levels. There are levels on national level, recommendations that are specific for certain districts of Ukraine. So we can't but mention those events of the 20th and 21st century that formed the Ukrainian identity. So it is hard to imagine a family in Ukraine that doesn't have losses or grief. For example, who hasn't suffered from Holodomor or repressions, or people whom we lost during the Second World War and also during the Chernobyl disaster. And of course, and such the communist regime that has been in Ukraine, it formed and formulated certain patterns of interaction and communication of Ukrainians with the system of with the government and with the representatives of the government. Until now, it is actually seen in the distrust to political and governmental political institutions. It is also connected with the system of supporting mental health care system when when hospitalization, for example, were used like a forced things or different other things. And it formed a certain level of stigma, misbelief, and difficulties to speak openly about psychic problems, and especially such psychic problems as suicidal thoughts. And now here I'm giving you an example at which a chapter of our report you can read more about this ideas, about this historic events, how they affected the search for help. Also, historical events of the 20th century, they are mirrored in the feeling of shyness, the so-called embarrassment, because when people having problems with psychic health, when they are not running to, so to say, to psychiatrists, for example, as in Ukraine and in other countries. And I still recollect the question of my colleague, a Polish psychiatrist. It was a big congress. And at the end of the 22nd year, 2022, he asked, Irina, how could it be that in Poland we have more than 1 million of Ukrainians, and we do expect that 10, 20, or 30% of these people, they really need psychological help. But for example, we saw only 1,000 Ukrainians at psychiatrists during this year. So I guess that this part of our report gives a certain overview and gives a certain clue to think what was the reason for that. And we see that because of the past that was full of collectivism and atheism at the governmental level, the understanding of the interaction of soul, body, and body, they really lead to the fact that Ukrainians, they still do not understand till the end how just a speech or communication and conversation can help. Ukraine is a diverse country, geographically and historically and culturally and religiously. But I would like to give an example of those ways of coping. If we don't refer to a psychologist, how can we cope with our problems and the stress of war? And now what differentiates Ukrainians from other nationalities is that we feel that we love gardening, is that we love farming, and the possibility to come back to this routine. It's very important to come back. So there is, for example, such a widespread destructive coping strategy as using alcohol, or for example, for instance, we can buy in a drugstore some psychotropic medicine. So to finish up, I would like to give several examples at the last two slides. So how these investigations concerning historical investigations and so on about seeking help and how to cope them, how they affected, how we prioritize these recommendations, and how we integrate this multidisciplinary approach into this review. So one of the furthermost recommendation is at the national level. So we say about the importance of local contextuality of interventions. We should locally contextualize it to the realia that we live in. It is possible to achieve it with several steps. Firstly, to strengthen the ability of local and other service suppliers. It is very important that the financing that we have and that we receive in Ukraine, it includes as informal services on the basis of NGOs, for example, and as well as formal services. When state enterprises, they become the parts of these projects. And also we could plan an important part of this project to support those who do this project. So we take care about those who supply the services, and we should understand also the local strategies of coping and to strengthen them, because high level of stigma and the absence of prioritizing of the problems of psychic health concerning other basic needs, it's a very important accent and very important stress. And the last slide, I would like to show an example how this historical and cultural aspect, they became the basis of recommendations according to geographical location of one or another part of Ukraine. So what do I mean? For example, everybody who registered in this webinar and this today's event, after the end of the webinar, will get a copy of this review via email. So you will be able to individually have a look after the end of the webinar and see. So in the recommendations, we separated depending on geographical location onto three parts. So recommendations for those regions that are most closely located to the front line, regions that were deoccupied, and the regions that are located the furthest from the front line. So they are close to the Europe. So an example of the so-called recommendation for those regions that are close to the front line. So to strengthen and support and unite people who live their own experience of overcoming and suffering certain events, for example, dislocation or any violence, gender-based violence or anything else. So in this way, we can support the feeling of control, and it is very important. One more important group that we pay attention to is youth and organizations that are organized by people according to their experience. The next example will be a recommendation for those territories that have been deoccupied. And in this context, we do understand the mobilization of resources and creating opportunities for events and for some activities that would enforce the dialogue. So, for example, if all the voices could be heard, what do I mean? Those people who have the experience of being displaced, or those people who live in these communities, those people who help, those people who are victims, those people who suffered after the occupation. And these events, they should be reinforced and should be directed to enforce social collectiveness, because war and life-threatening things, they do disrupt a community, but we have to keep united. And the last recommendation that is connected with the regions that are located closer to Europe, because of stigma, so it is very important to integrate the psychological support to psychological help. So, for example, we can do the professional things at hospitals and so on. So thank you very much for this introduction. So my colleagues, Orest and Hannah, they will continue presenting another parts of our report, and I will be glad to answer your questions after they having been presented their reports as well. Thank you.
Thank you so much, Irina. Would you mind, Irina, maybe copying your email addresses here in the chat, because I think they were so briefly on the screen. So if people have questions, they can contact you. That was a wonderful introduction to this. I think we will just move on straight away. And I would like to ask Orest if you could start your presentation, please.
Добрий день, колеги. Я сподіваюся, мене добре чути.
Good afternoon, colleagues. I do believe that you hear me well, so I would like to say thank you to Armed Forces of Ukraine, what they do.
В той час, як ми можемо думати і розвивати послуги в сфері психічного здоров'я для того, щоб їх покращувати для всіх людей, які потерпають від війни, тому що Україна опинилася в повномасштабній гуманітарній ситуації, і ми повинні, розуміючи контексти різних регіонів, будувати відповіді на ці виклики. І, власне, перед тим, як перейти до своєї презентації, хотів би так для вступу сказати, що це було нелегке завдання написати цей звіт, оскільки ми не мали...
Sorry, just a sec, check. I think we may have lost interpretation.
Do you hear me right now? Excuse me.
Yes, I hear you right now.
Thank you very much. The only thing that, as far as I understood...
Can you hear us well?
Now I can hear you. Yes, Olesya, I couldn't hear you before at all. I realized.
Now you hear Olesya, yeah? Okay.
Can you hear us now?
Good.
Can
Thank
you
you.
hear me?
Perfect.
I'm so sorry for interrupting.
It's okay.
you.
It's okay. It's okay. It's
Please,
okay.
would you mind just repeating that, Orest, so that we can get the
Я
interpretation?
можу продовжувати. Добре. Я, власне, хотів би
So,
почати з того, що в нас
I would like to start by saying that we didn't have the task to describe everything in great details, and we had to give the recommendations because the situation is changing every day and the context is changing in different regions. And that is why for us, it has been very important to foster the discussion so that we could exchange our opinions as often as we can, and we could take a look at different demands and the ways how we could react to the challenges in the spheres of MHPSS, because in the state of war, there are no right or wrong answers. And that is why we are trying to find the best solutions in terms of how to face the terms. Of course, we are talking about our experience that we use. We are using international recommendations. And while if talking about Ukrainian context, as Irina has mentioned, Ukraine has very traumatic experience and history of the 20th century. It is the history of trauma, but it's also the history how Ukraine actually managed to face the challenges, including mental health, as well as, yes, sometimes they had to cope with that themselves. And yes, it's also some type of stigma to the healthcare system, which Irina has mentioned. And yes, these are challenges which we must scientifically study, and we must think how to find those best approaches so that people would come and ask for help, would seek for help, but this help should also be very professional. So while moving towards the information which we have in our report, out of my experience as a doctor who started from the early 2000s in the system of mental health care, I may say that attention to mental health care from the state, it actually happened after 2014. And this is when we had the concept of humanitarian context and MHPSS context. It started to focus on the eastern regions. But after the full-scale invasion, the whole country appeared to have problems in terms of humanitarian issues, and we started to react to these urgent challenges. And starting with this full-scale war, I may say that in our country, and we as co-authors of this report may say that Ukraine has made very significant steps towards strengthening the system of mental health system. And we are talking about the national health system. We are talking about the support of the primary link of in terms of family doctors as a separate institution. And while having this network of professionals in 2022, we actually had an opportunity to create a separate package to support people on the first level of healthcare, which was basically endorsed by our First Lady, Olena Zelenska, as well as our international partners. So in the program of MHCAP, and I may say that this institution, healthcare institution, it existed in Ukraine, and now, thanks to this, Ora, sorry, we cannot see your slides. Well, yes, this is the first slide, and I didn't want to impress people with the number of slides, so I'm just experiencing and sharing my experience, and I think this is very important. So the concept, it was approved, I would say maybe a little bit later than we should have done that, but it was, which is very important. It's a crucial element. And in terms of these fundamental basis layers, which actually helped us to react and work on the full scale, this was important. So what concerns the mental health care system, yes, I may say that it is not one single one, because we have different aspects of it in different spheres, or I may say that it works under subordination of different other spheres. It's education, healthcare, some security ministries that are also involved in it. So the changes that are happening in these spheres, unfortunately, they are not synchronized. That is why it's difficult for us to talk about the development of this system as one unit, but the changes are happening. And if to talk about this desk review, I say that it has been done since 2022, and now we are in 2024. And when we are talking about the community-oriented services and some local hospital services, we don't have them in this report, but yes, they are happening. And I say that this is the fact that we have on Ukraine the level of country government support. And this is very important because out of my personal experience, I may say that when we organize the help and when we are talking about psychosocial support and mental health, when we are working together with international organizations in Lviv region, our international partners, sometimes they don't understand the context to the full. Maybe they don't understand all the processes in great details. That is why it's very important for all of us to talk about it, to describe it as much as we can. And it's very important for us Ukrainians declare the processes. And this is important for us to have our system strengthened. Yes, when we are talking about the full-scale invasion, we are talking about very many initiatives in terms of supporting very workers in the social spheres, NGOs, hospitals, everything. As far as I'm concerned, I think this work needs great coordination and synchronization, because unfortunately, because of lack of coordination, we lose many resources, finances, human resources, everything. That is why we still have very much work in advance. So after full-scale invasion, the government actually paid attention to the sphere of mental health care even greater. And we have now the coordination center of mental health care under the minister, and we have the endorsement of the First Lady. So now we see how the government pays attention to the humanitarian MHPSS. So we see coordination centers, we see the support of the civil services, all this that is happening. This is the national MHPSS. It works differently in different regions, but it's a very good mechanism to coordinate international support and help, to coordinate local resources, as well as to answer the challenges, respond to the challenges which we have in the sphere of mental health and psychosocial support. So now in our region, for example, we have the working group, which we would like to coordinate more with the group of psychosocial support in the region, because sometimes we basically are doing the same thing. So now we are trying to have a coordination with the HOS, and this is our decision, our local decision. This is our local experience, which I hope one day we will have to talk about in details more, and we would describe it more. But yes, now we are in the context of these challenges, which are changing every day, and we are facing very many challenges. So in our desk review, we wanted to show this variety of experiences, variety of activities, but at the same time, this broad network of demands which are changing, which are also growing. And this is, so to say, the word of remark to the community for us to coordinate, for all the citizens to coordinate. And this way we would hope to actually cover all the challenges. So in this word, I would thank you for listening, and I would pass the word to the following participants. Thank you very much.
Thank you, Orest. I think we missed out on some of your beautiful slides, but that was an interesting story nonetheless. So the words were more important in the end. I know that there was a request in the chat about sharing the slides. I will ask the panelists if they feel comfortable doing so later. If they are fine with it, we will include it in the email that we send to participants when we also share the report after this webinar. And thank you for everyone who keeps on sharing their introductions here in the chat. if you also have questions that you want to write down already, please feel free to do so. But we will take more of the questions and answers then, or we will take them all after the last presentation. Thank you so much, Orest, for your part. Ganna, would you like to go next, please?
Yes, I would like to go on, and Orest did a beautiful job teasing, creating a teaser for his presentation, and everybody is now very much interested to see what was on the slides. Thank you, Irina, thank you, Orest, thank you, Sarah, and thank everyone present today. And I thought that it will be easier for me to speak English because that's mainly my working language at the recent times, but no, so I will be, it's an important and exciting moment for myself to be presenting, so I am worried a bit and apologize for stumbling and being emotional at times. So I will ask Irina to help me with the slides a bit. Humanitarian context. These are more of the illustrations and schematic pictures. In order to, and again, this one, I think it's dated from last summer. It's not the recent one, but to get into the idea that humanitarian context is dynamically changing on one hand, because it's very much dependent on the development of the war and military actions. And thus, the humanitarian needs of the people are changing, including internal displacement within the country. And it is important to be mindful. But to start with the humanitarian context, I should mention that the humanitarian response in Ukraine didn't start in February 22. It started in 2014. As humanitarian situation. So we do need to acknowledge, and it's not only that we need to go back into the century history of the events that Ukraine went through that had the impact on resilience, but also lessons from the humanitarian response and what have we learned and what we can do, but also what we might have lost within the lessons. So humanitarian context, once again, very much dependent on the proximity to the conflict line. Internal displacement is massive, according to, I think, the recent humanitarian response plan released in January. It's up to 4 million internally displaced within Ukraine. This contact line, which is highlighted in red, and also active military actions, implies that this will be the this is the part where people have no place to return. So I think it's important to realize when you think about the needs, and as this report was drafted during 2 years, we need to also be thinking how we can anticipate future coming needs, right? So we keep hearing a lot from the people, I don't have anywhere to return to. And it's true for many inside Ukraine and as well as outside Ukraine. So the next slide is about external displacement for those Ukrainians who have made the choice to seek safety outside Ukraine. And it's about 6 million of them, according to various estimates globally. The longer the conflict continues, the war continues, the lower is the estimates of the percentage of the people that are planning to return. Again, according to various types of assessment. This data is important also that, and again, what does it mean for mental health and well-being and MHPSS response? these are the people that were members of the community, partners, members of the families, and it has a big implication on the social element of psychosocial supports that we are building. And the separation, which is a very important stressor and remains to be one. And also, it is an important element of the divide that is observed and has an implication on the social cohesion within Ukraine and between Ukrainians as well. There's more and more mentioning of those and divide for those who have stayed and those who have left. And again, a note to make that this is a separation is an issue, and social cohesion is something to be addressed, not always something that is addressed in humanitarian and emergency response and HPSS interventions. Usually it's something that follows up after. We can go on. Grief and loss. I deliberately start from grief and loss because one lessons we haven't learned from the responding for 5 years in Eastern Ukraine and from the start on the onset. When February 22 has happened, again, we have seen a massive rise of and focus on post-traumatic stress disorder and mental health conditions. We have seen estimates and of prevalences of mental health conditions among Ukrainian populations to come, but we have rarely seen discussions and acknowledgement of losses of people, and also addressing that from the psychosocial standpoint and activities and interventions organized. Whereas loss is something that has touched every single Ukrainian. From the magnitude of losses, of course, cannot be compared. There are many of those who have suffered physical losses, and I mentioned the losses of property, houses, apartments. There's loss and deaths of loved ones and family members. There's losses of health and functionality. There's then we move on to status and professional roles, social connectivity, family separation, and then also the one that still feels like grieving is and there's a grieving process that goes on underneath, is the loss of sense of belonging and the loss of sense of home. Those symbolic losses that we all, loss of identity to the extent. And sometimes it's becoming more profound. It's a loss of meaning and loss of sense. And again, 2 years into the war and living into the war, responding to the war is something that used to provide strength and resilience and to be the sense of strength and resilience, but it's been exhausted, and it does require more support for people to recreate it and help to find it. We can go on. Pyramid, very familiar. I've seen it in Nora's slides. This is something to acknowledge that it is still a bit inverted in Ukraine, but a lot of investment, times, efforts has been made for the past 8 years to reform the health system, to create, to build on humanitarian response best examples and create community-based care. But more coordination is never enough. Integration of mental health is never enough. And complementarity is never enough. So there's more to improve. And this is true for humanitarian organizations and non-governmental sector working closely together with the state providers who are ultimately responsible on the ground and coordinating and being accountable for the population and population safety and health. As Oris mentioned, the coordination on the local level is very, very much important. Again, acknowledgement that system is there. A lot of interventions have been tested and piloted and translated. And it is important to build on whatever exists rather than and scale it up, rather than bringing in new tools with the idea that something that has worked somewhere is this panacea or a magic tool that is supposed to help. There are things that are there sometimes that just require more resources and wider dissemination. And we can move on. Well, that's also a bit of an illustration. This is this is the map of mental health and psychosocial providers or organizations that are engaged somehow in delivery of the services across Ukraine, which we see it's massive. I think we should acknowledge that mental health and psychosocial support has grown for a decade globally and has been high up in the agenda, grown as a sector and gained its importance and voice. And that's also one of the implications of that. A lot of international organizations are trying to come and plan activities around it. One important thing is that, and it's important to point of reference, MHPSS technical working group on national level exists. There is a resource, there's a link. There are regional technical working groups. I understand, but Orest, correct me if I'm wrong. There are a bit of different in terms of focus and nature. National are more in coordinating more strategically with national institutional bodies engaged, and regional are more for operational coordination and very on the ground decision making and complex case solutions and building effective referrals. Humanitarian response and beyond. We included the recommendations in the recommendations sections. Recommendations are not something novel. They are not something innovative. They are all based on the guidelines, the IS guidelines for MHPSS in emergency settings have existed there. The English in English it has been released globally in 2007. In Ukraine, they exist in Ukrainian. They have been translated in 2017. I've seen some colleagues that were working together in the project back then in Ukraine included that as a point of reference. It's important to go back to that. It is the basic. If we do this basic, we already will be ensuring that the quality work and do no harm is done. The needs are high. Everybody living in Ukraine is impacted to some degree or another. I think there's it's never a task for specialized services or for psychologists, although I would still think that Ukraine still remains the highest in number of psychiatrists and psychologists in Europe. It will not be enough, but it does call for integration of elements of mental health and psychosocial support in different sectors, wash, shelter, livelihoods, mine action, education, protection, health, everywhere you go. There is an MHPSS element to it that can be addressed. And again, there is international guidelines to refer to that can be taken as a framework, as a frames of reference, and contextualized and more detailed and adapted to Ukrainian context. Coordination, local coordination with the decentralization is important. Coming in, and it's important to build on resources available and strengthen existing structures that are responsible formally for the response. On the national level, it is important to align strategically with these documents like the National Mental Health Plan. The response is longer term, so it is, I think, important for the bigger impact to plant the seeds mindfully, hopefully that these investments will pay off, because again, the needs are very, very high. Assessment and monitoring, it's important to do, but not overdo. Sometimes we are, again, and this is for call for internationals, and sometimes for also for research sectors, we collect a lot of data, or we don't collect a lot of data. Just referencing, know the context, learn the context. And I think this is one of the purposes of this report, also to provide this basic context to those who are planning the response. Also, be sure that the context is dynamic, and build on expertise and align that with the needs of the people that you respond to. But also do not acknowledging the fact and the vulnerabilities of those who are living. We do understand that it doesn't make a lot of meaning to ask again and again. Sometimes we do have groups of people and international organizations asking the same questions for the same people, but just sharing these assessments as well. Community engagement. This learned helplessness, I think it's still there, and with the number of internally displaced people, there are mobile shelters, and there is a high rate of dependency on humanitarian aid among specific more vulnerable groups of population. Again, this is one of the lessons I think we didn't learn from the response, to know how to mobilize the people to look for the solutions themselves and ask for the ideas, and ask for their contribution as well. So let them recreate and facilitate this new community creation, because again, all of the previous community structures have been completely ruptured. So this for sure requires facilitation, how we bring people together and connect them, but then help them collect ideas, plan, and support them in hopefully efficiently acting together. Social cohesion, I have mentioned, it is very, very, very critical to address, and it will continue to be critical again in the longer run.
Wonderful. Thank you so much, Hanna. And also just thank you for all the panelists, Irina, for taking us through the historic, cultural, contextual side and the implication, Orest for the health system and current needs, and now Hanna again for this beautiful overview of the humanitarian situation and what you've been able to learn from the last couple of years, and also from the previous years before that. I'd like to really thank you for your generosity in sharing, and I would like to open the discussion. So for this discussion, I would like to invite any of the participants to raise your hand so that we can see if you have a comment or question you'd like to address to one of our panelists. if you feel more comfortable, you can also just write it in the chat and we can find it there. Let me see. I don't see any hands up yet. So let me then ask. Oh, now I do see. I don't know if I pronounced your name correctly. I'm sorry, Stepan or Stepan?
No worry, yes, Stepan. Yes, it's correct. Дуже дякую за можливість за вашу презентацію.
Thank you very much for the opportunity for your presentation. It was very interesting to see this overview, a deep overview of this situation. I would like to clarify for myself, and just to clarify concerning Irina. So when the presentation was made concerning this report IUM about the diverse needs that are present in different regions and in the Western Ukraine, and it was said that there was a need to integrate mental health, for example, to be provided in the places of mental health and health security. And this component of mobilization of security and community dialogue, I haven't heard about it. So that it was more in the north. What do we see? We have this community-based protection component, and it's very important. And this component is very because there are a lot of IDPs, and making up a dialogue sometimes can lead to qualitative changes in the community itself, in order for them to actively be involved in identifying the aim of the community, to building the space, for example, making up decisions concerning community. And this is the first thing. And one more question, probably a reflection. You see that how you see this part of the western part of Ukraine and its further development. What will be the most deepest needs for this region? So what do I see now? For example, a lot of people say that this component emergency, for example, even our donors say that it goes mostly to the east of Ukraine. But here we might have this long-term, long-run decisions. But what we see from the monitoring, that still we see a lot of needs. So the context is a little bit of emergency. So I would like to hear something. Thank you very much. Thank you very much, Stepan. So I would like to address the second question to Orest. So about Western regions, about the difference between reacting of emergency settings and dislocation. And I would like to say thank you, first of all, for your bravery to have put the first question and to be courageous to put the question being the first. I guess that we have done our work correctly. So we have limited time now in order to present the whole report. The whole report accounts for 70 pages, and 20 pages of them are recommendations and analysis of these gaps. Probably that's why you felt such confusion. Probably I've confused you. I just wanted to make an example and just to make you feel alive in order for you to refer to the whole document and to see it at the national level, firstly, at these recommendations, where we underline the importance of these activities that reinforce social integrity and communication and jointness on the national level. Then we talk about focus examples, about those things that we acknowledge and notice according to different regions. That's why I agree with you that it is important for every region, and not only for the north, for example, or for the west. It is important for all the parts. And we see that because of west, that, for example, west is located furthest from the front line. It's close to Europe. So, for example, military people, for example, they get their rehabilitation, medical rehabilitation, they can be located there, and they do really need there. at the stage of medical rehabilitation, they also need psychological rehabilitation as well. And we wanted to emphasize it as well. Thank you. So Orest, probably you would continue or answer the second question. Thank you very much for the question. And it is true that there are a lot of international organizations, and they really work in the territories where the situations are acute. And in the situation of war, we see more gaps that are needed to be involved, the local government and national and state policy. For example, certain ways and resources of financing in communities. For example, it's like a difficult discussion, and here we need solutions on the national level. But these things haven't been discussed till the end. For the state to acknowledge it, to acknowledge the necessity of financing, or give the possibility for the communities to finance. I understand what you are talking about, because we come across the same situations, and I guess that in our region, so we see those needs very, very much, because we have formed that mechanism that helps us to see those needs. And we try to cooperate with local organizations, international partners, in order for jointly to make up solutions to these problems, to these challenges. It's a dynamic process, but without national support, without national level of support, it is very difficult for a community to handle and to build some answers to these questions. Thank you very much, Orest, and thank you very much, Irina.
Thank you. Anton, please tell us your question or comments.
Доброго дня. По-перше, дуже дякую за...
Good evening. So thank you very much for the materials shared. I do really appreciate. I have such a question to the speakers. The first thing is, according to which indicators you see the results of your work. So, for example, with the groups. So, what are the indicators? For example, what you do in MHPSS that it gives the results. So, how do you see that? Because it's sometimes it's very difficult to determine at which stage are we. And the second question is probably about your personal reflection. How do you see the work with preserving communities and preserving the idea of community among Ukrainian refugees that are located abroad? So these two questions. Thank you very much for your answer. Do believe I will get it. Thank you.
Thank you very much.
I can take the second question. I can give the answer to the second question. Orest, what about you? I can try to answer the first question. Thank you very much for these good questions. So if we talk about indicators of MHPSS, we looked at the wider picture. So we looked at MHPSS, how is it special from the context of development. But if we talk about indicators, each international organization has its own indicators of fulfilling its projects, and WHO and the committee also has guidelines. And MHPSS guidelines also. So we do have it in Ukrainian as well. And we had some training and education recently on it of using. There are tools, actually, they exist, but we haven't seen the need to write about them and to write about using or doing one or the other activity from MHPSS. So my answer will be this one. I can say that it depends very much. It depends on the intervention itself, because group activity is very much in general. It depends whether it's open or close. So that's the aim that you are targeting at. And then the choice of the tools, actually, according to the level of their efficiency and effectiveness. Of course, in this sphere, good tools work here better, but we have to balance, actually. So we have to balance between the necessity to collect information that will give us some informative things concerning about basic qualitative indicators, and it will give the possible necessary information to the donors, and of course, and it will give us information concerning which potential additional needs do we have. But still, I come back to Orest's answers that it requires like it requires a certain research. So which service, which aim, and so on.
I want to address the second part of Anton's question and start answering in English as well in order to engage our international participants. Because I know that interpretation, it takes time and it shortens the answer. But, Anton, if I understood your question correctly, is how to facilitate integration of Ukrainians displaced outside Ukraine into a host community, and how to create opportunities for this collaboration and cooperation. And I want to bring your attention that the current project that was initiated by ARC International is a very good example of such collaboration and cooperation, because initially when this idea emerged, so Annelieke, who is here now, who is director of ARC International, and Megan and Sarah, who represents ARC International, they had an idea that they would invite a Ukrainian mental health professional to write this report and to unite other experts from Ukraine or with Ukrainian background to collect this information. So I think empowering, Ukrainian colleagues and create opportunities is very important. I can bring many more other examples. It's just one of them, but this is critical and this is very important to involve representatives of the Ukrainian community in this case, or other communities in other cases in the projects like this. Thank you so much.
Thank you all for your responses, and thank you for the great questions. There's one more hand up at the moment. Peter.
Yes, thank you so much for all your helpful contributions. And I want to ask Orest. Orest, you gave us an empowering information about an important Ukrainian resource that has been touching me very much. You talked not only about your history of trauma, but also about history of resilience. And I think we have to know more about it because it might be a helpful base for further cooperation.
Orest, you are muted still.
Now it's better. So thank you, Peter, for question. This is a little bit complicated and complex question because all what we are doing here in Ukraine, this is the example of resilience, beginning from the armed forces and throughout all the country with professionals and not professionals who are coping with stress-related issues. And I think that our ability to cooperate and communicate, nevertheless, on the challenges and threats, it's also the example. And we have a lot of good initiatives, national, local initiatives to support people, provide trainings all time, different discussions. Sometimes it's lack of understanding because of complex topic of mental health and psychosocial support. Sometimes there are hard discussion, but at the end we can choose some compromises and move forward. So I think this is maybe also like very wide answer to your question, but let's communicate, cooperate, and thank you all foreign colleagues for supporting Ukraine with different resources, knowledge, trainings, support. So we appreciate this very much. Thank you, Peter, for the question. Keep in touch.
Thank you very much, Peter and Orest. I see Rennet from the Dutch Ministry of Foreign Affairs is also here and has their hand up. Please go ahead.
Thank you, and thank you very much for the presentations and for this possibility indeed to listen to your expertise and your contextual knowledge, and which is so important. And I have a question which is probably as at least as difficult as the one of Piotr just now. But on the one, you referred to the historical legacy, or maybe the historical context, which I think it's very important to looking from afar, but having studied Soviet history and Soviet political situation since for many years, I think that that context, the context of Stalinism and of the Holodomor, and is very much influencing, possibly at individual level, but definitely at society level, influencing the situation in which you're now trying to organize at all different levels MHPSS, and especially if you talk about how to work towards re-strengthening or regaining or retaining social cohesion. I think a lot of thinking also has to be given to those, on the one hand, that legacy and that setting, and also a level of reflection and communal self-reflection, maybe also, which has not yet happened on a number of those historical developments. And at the same time, the very urgent need to provide contextualized MHPSS now for so many people. If you have, it's far too broad a question, and the legacy of the as you refer to, of the highly institutionalized and not so much human rights-based Soviet mental health system. So, is there space to also think about how at the level not of individual services, but how to prepare for that enormous set of challenges, which I think is there now and lays ahead of you? Sorry, it's far too big a question, but even for a coffee afterwards, I would like to raise it. Thank you.
Yes, thank you so much, Renee, for this important question. And as well, I want to highlight that unfortunately during the communism era, there was authorities initiated conspiracy of silence. And this is only recent development that we can openly speak about those mass casualties and mass traumatas that I have shown now. And, you know, I am born the same year when Chernobyl disaster have happened. And when my colleague asked me, do you have research on how Chernobyl nuclear disaster impacted mental health of Ukrainians? I was confused. Even myself, being a clinical psychologist and into this for many years, I was surprised that I never thought about that. But good news is that we started. And I think with small steps and support, we will be there sooner or later. And I'm happy that this specific report includes historical overview and reflects on how it might have impacted mental health formal system in Ukraine and why it is important to move from centralization to decentralization, because it's actually can also impact this perception of self of our nation in future. Thank you. I hope Anna or Orest, or maybe other participants. So it's not just that we are answering all those questions. You are invited to reflect as well as a participants of this webinar.
Great point, Irina, and a great answer as well. Orest, would you like to reflect further on that?
Yeah, thank you very much for a very good question. It's a complex question also. And we have to think about recovery yesterday, but this is also like our urgent threats or challenge for the system approach. And this is quite complicated because we didn't have enough discussion to discuss inside the country. What do we mean mental health, psychosocial support, about the researchers? So we didn't have time and luxury to provide the pure science, for example, as a European country after Second World War, to develop the science and to build policy on this science, because Soviet legacy are still here, and there are a lot of witnesses lost, especially about Holodomor. Hopefully we have some scientists who begin to write the articles, but we also don't know how Soviet consciousness influenced mental health, for example. So we need more evidence, more researchers, and more time to do this, but now we have much more urgent needs related to the basic needs, and I hope that we will maybe strengthen community of people who will be interested to build this network and to cover the different part of this story: researchers, service provision, policy making, and others. So thank you very much. I will think more about this. Thank you.
Thank you, Orest. And like Renat says in the chat, these reflections really take decades in our society. Andrei, do you have a reflection on the same topic, or do you have another comment or question?
Andrei, probably Sasha, it's you.
Oh.
It's me, Andrei. Okay.
Yes.
Hi. So I didn't know that I'm Andrei, so I'm sorry. Yeah, thank you to all of the speaker participants for this very insightful seminar. I wanted just to comment on the last question as well, and maybe just reflect also on my own experience as a practitioner with Ukrainian refugees, and being also socialized in the Western world, let's say, in Germany. And to my mind, I think that this question of trauma is quite important. And this is what, I mean, it's always qualitative data from its clinical experience, but I see people who are really severely affected by the ongoing atrocity during the full-scale invasion. They basically all of them who are severely infected have a reactivation of childhood trauma. So this is a question, or maybe like a suggestion, or combination of both, is to do we actually systematically assess it? Because I think that this is quite important. What intervention do we provide? Because this kind of atrocity, this just reactivated a lot of childhood experience, which is connected to also to my experience. Like if I compare the Western upbringing and the Soviet type upbringing, and with this kind of lack of emotional engagement with children, neglect, like a high degree of violence, and this is something, I think, which is quite important. And I just would also interested in your opinion on that, and how do we do this? Because I like this story of Ukrainian resilience, but to my mind, I mean, it is very important, but to my mind, I have the fear that we just cover up a little bit of things which needs to be addressed. And not everybody can just keep keep this kind of to this high level of resilience, which publicly is kind of demanded by the society.
You bring a really excellent level of nuance. Thank you for that. I wonder if the panelists want to just respond, or if there's a clinician, Ukraine-based clinician, and the audience who would like to respond, you can also put your hand up.
Maybe I can start, and I can call as well international colleagues and Dutch colleagues to reflect on that, because I think it's relevant not just for Ukrainian context, but for other settings as well. But yeah, I agree with this phenomena that the current full-scale invasion, it evokes, past traumas, and not just but our ancestors, our parents and grandparents and their grandparents. So it reactivates this multi-generational legacies of trauma. So we have a working group of ICMGLT Center, which studies this transmission of multi-generational studies. What we did, we translated an inventory. But what kind of challenge we faced is that this inventory was invented for Holocaust survivors, so children and grandparents of those who faced Holocaust themselves. So when we tried to adapt it to Ukrainian context, it appeared to be very challenging, because you need to mind about Chernobyl, Second World War, repressions, Holodomor, discrimination and collectivization. So how to put everything in a single inventory, it's a challenge, but it is a call. And I invite colleagues who want to join us with this task. Please feel free to contact me.
Thank you. There's two things. So there's one question in the chat, actually, and then I have also a question that I'd like to address to the panelists or anyone else. So in the chat, we saw a question in Ukrainian, and as a translation, I got sent from Katarina, our lovely chat moderator, and it says, what do you think is the reason for the curtailment of MHPSS programs in the northern region, namely in Chernihiv Oblast? Is it because there's still a need, and only now have people started to trust and go to psychologists? So that's a question from the chat. And then I also wanted to ask, there was staff support was briefly mentioned there, but there are really a lot of people responding to this crisis in Ukraine in particular, not just in MHPSS, but in other kinds of just first responder services. And I was wondering, what do you see right now happening? Maybe this is for Orest, for you. What do you see happening with taking care of the carers and those who are responding to the crisis? Is there a national level recognition that this is something that we should pay attention to, or has there not really been time for that at this stage?
Я перепрошую, в мене були проблеми з інтернетом. Чи можете повторити запитання?
I'm sorry, I had a problem with the internet. Could you please repeat your questions as Orest?
Orest, I was just saying that my question was about supporting those who are now during the emergency response in Ukraine as well. So you have all these local organizations as well as international organizations providing humanitarian assistance in various forms. And is there some recognition and that they might also need additional support, especially those who are local and they are facing the same atrocities, and on top also trying to provide this emergency assistance? So is there some focus on staff support, or is it a bit too early to focus on this? Or
Дякую за запитання.
Thank you very much for the question. Well, the understanding is there, and as I see international organizations take care about their staff really a lot in terms of supervisions, in terms of all the support, which unfortunately we don't have in formal systems of our Ukrainian social sphere, and as well as mental health care. And I think, you know, we should take a look more in terms of international organizations to support our local resources in healthcare, formal healthcare, because the nurses as well as doctors, they are working full scale and they're sometimes overloaded. And what concerns their psychological health, you know, honestly speaking, I haven't seen very many initiatives in terms of supporting their psychological state. And, you know, I think this is the challenge for us and for the system of healthcare in Ukraine on the state level, because this factor should be taken into consideration in terms of providing services in future.
Thank you.
Thank you.
Some of you want to reflect on Maria's question in the chat as well? Wonder if any of you had a response to that.
If I may, just to the help of the helper. I mean, I just wanted to mention that there is a initiative from Germany, sponsored by the Ministry of International Cooperation, and we have some online courses, burnout prevention for medical professionals and also emergency workers, which are online accessible. So if there's an interest in that, you can Google like Solomia project, and they contact us. So just.
Thank you. Might you be able to write that in the chat so that it's easily findable? So thank you.
Yeah, I will write the address of the project in the chat. Yeah.
Wonderful. Thank you very much. Relinde, you have your hand up as well. Would you like to make a comment as we start wrapping up this conversation in the next couple of minutes?
Yeah, thank you, Sarah. And thank you so much, Irina, Orest, and Hannah, for your very interesting presentations. I have a question to Hannah. Actually, you were reflecting on the importance of localization and community engagement. And yeah, I very much agree with that. I think we all do. And I was just interested to hear, what do you hear back from the communities? How do they perceive the support that is coming? And do they feel enough engaged? Even though maybe it could be more, but yeah, just very interested to hear some of your insights on that. Thank you.
I'm being based now in Denmark and working with IFRC, and there's a big project and with 25 Red Cross national societies across Europe. So I've managed to see quite a substantial number of both responders and Ukrainians living in different countries. What keeps coming up is as the major challenge now is the language. But when we deconstruct the language as a barrier to connect and connect to the host community and connect is more. So there's it should be, I think, more and it could be more done. So the first step is to help people to connect between each other, because it's not naturally happening. People are living in urban settings, and it's either the workplace, so there's not a natural way. So that's the task to meaningfully to find the ways to gather people together around the shared senses and meanings, but then how to connect them to the host communities, how to create these bridges and exchanges. Because I think what was mentioned, the distrust and the lower levels of trust, not only to the systems, not only to the pre-existing, it also demonstrated to the systems of the countries people hosted in. And we've heard this feedback from the officials and administrators as well. We have a feeling they don't trust us. And we have a feeling that don't trust us. So there should be this acknowledgement that probably it will take more time. It will take more slow and careful movement towards each other. But always it's we're back to humanity. Sometimes when we speak mental health and psychosocial support, we are reminding humans to be human. We are teaching them to reconnect. And this happens when we share the same values, and this is something to build on. But definitely it can be more things done on linking up Ukrainians with the host communities, which is a difficult task, because there's also this feeling of temporarily still among the people, among many people. Like, I'm here and it's gonna end soon, and I'm gonna leave, and there's nothing, there's no need for me to make an effort to. So how do we also acknowledge that as a barrier and find ways to communicate that there's still life and an importance to continue living even while waiting until the war is over?
Thank you. Thank you, Irina, for the question, and Hannah for the answer. Irina, we are running to already our end time. Would you like to give a conclusion for us?
Yes. Yes, I want to share my insights and reflection about this meeting, and the difference between the questions from Ukrainian community and international colleagues. There is a clear difference that Ukraine is asking, why are you cutting funds? We want to provide support to our to Ukrainians in the north, in the south, in the west, everywhere. Just we need, this extra funding, and international colleagues questioning about this really complex issues of multi-generational legacies, and how can we study this and address it? Is it important or not? And I want just to highlight that actually ARC International have this pilot project of Care for Carers to support social policy services in Ukraine to prevent burnout. And what we have identified is that on a national level, there is a gap of understanding how can we support staff and in this governmental organization, meaning create time and space for them to reduce the burden of workloads, to create this system of support. So you might have the best courses, online training, but you need both. You need psychoeducation and you need transformation on a system level.
Thank you for that reflection, Irina. That resonates very much. Is there anything you'd like to add, Orest and Hannah, in one or two sentences?
Дякую дуже за час, за вашу увагу.
Thank you very much for your time. Thank you for your attention. I think we still have many reports and reviews and recommendations, and I think this was just the first step to, so to say, reflect on what is happening right now and to put some accents. And I would like to express my gratitude, sincere gratitude to everybody, and I truly hope for future prolific collaboration.
Thank you.
On my end, and speaking and working in humanitarian context before and now, and I think many of us present here, this field of work is the value-based work, and I think it is what keeps us going and gives us energy and hope when we are hopeless and at times feeling helpless as well. So this is also a moment to thank everyone in Ukraine and outside Ukraine doing the work and being engaged in the work to support Ukrainian people and express support in various ways. and also supporting ourselves and finding meaning and purpose in the work, and being able to continue seeing perspective and the future, and supporting those who are near us and our peers is also very, very much important, because we all have difficult times when we do need that shoulder and support. And for me, this process of co-writing was also as such. So I'm very grateful to Irina and Orest, as well as I'm grateful to my colleagues from the past work that I've noticed that are present here. It has been always a pleasure.
Thank you so much. Thank you, all the panelists. This was really wonderful today. And thank you for all the participants, all the attendees, for your lively discussion, for your contributions. As we mentioned at the beginning, you will receive an email in due time following this webinar, where you will get the executive summary and the link to it on our website as well. I hope many of you will make good use of this report. Thank you, and have a really good evening, everyone.
Thank you so much. Yes, have a nice evening.
Thank you.